Good afternoon or good morning, everyone who is joining us. We'll just give a few more moments for individuals to join us, to find their links, to join us here on Zoom this afternoon for the NNHAAD panel discussion. Okay, so we'll go ahead and get started for our webinar this afternoon.
Okay, welcome everyone, and thank you, Savannah. My name is Elton Noswood. I am a member of the Navajo Nation. I'm the co-coordinator for the National Native HIV Network, and we welcome you to our virtual presentation today and panel discussion in celebrating and discussing the history of the National Native HIV/AIDS Awareness Day. So we're really excited to have this presentation for you all, just to give some background and understanding of this special day that we've created, and then also to see some old friends and colleagues and relatives that we may not have seen in a while, a number of years. So we're really happy to have Diana Mitchell and Pamela Jumper-Thurman join us today as a panelist, as well as Kurt Begaye, and each of them will be helping us to share a part of their story and their involvement in developing this day. As you can see, our outline for today's discussion will include housekeeping, introductions, an overview of the National Native HIV Network, and then a facilitated discussion with our panelists. And then we will be having some questions and answers as well.
For housekeeping today, this session is being recorded and will be shared on our Facebook page and also the YouTube channel. Please subscribe to our YouTube channel and also like us on Facebook. You can find us at Native HIV and also the National Native HIV Network on YouTube. If you could please introduce yourself with your name, your tribal affiliation, and the agency in the chat box, please. And then on the bottom, you'll see the Q&A section. This is where you can post any questions that you might have for our panelists. And it's a great way for us to keep track of all of the questions so that they don't get missed in the chat box. And then as well, there will be an evaluation that we will send out in an email. So please look for that in your inbox with the follow-up email from the webinar. My name is Savannah Jean, and I am the program director for the Community Health Education and Resiliency Program at the Albuquerque Area Indian Health Board, and also an administrator for the National Native HIV Network. I am Danette, originally from Pinon, Arizona.
And I went a little bit ahead of myself as I started this presentation, but I also will be moderating as well. I am a member of the Navajo Nation, a co-coordinator for the network. And I have the esteemed pleasure of introducing our panelists who have joined us here today for this presentation. So I'm going to read their brief bios for everyone so everyone can get to know them or reacquaint yourselves, with our good friends on the panel. We're very happy that we're joined by Miss Diana Mitchell, who is Northern Paiute and a member of the Pyramid Lake Paiute tribe, and currently works as the prevention coordinator for the Sumunumu Pyramid Lake Tribal Health Center in Nixon, Nevada. Diana has been trained in a variety of prevention subjects, including suicide, HIV and AIDS, tobacco and substance abuse as a peer support specialist. She is a certified global appraisal of individual needs, GAIN, and is also administrator for the Sumunumu Substance Abuse Program. Former experiences that she held and worked for was at the Intertribal Council of Arizona as an administrative assistant and instructor trainer for the Red Cross, as a Native American trainer, as well as a regional National Native American STD HIV/AIDS prevention program. The Intertribal Council of Arizona Incorporated collaborated with the National Native American AIDS Prevention Center and KSA in the development of the National Native HIV/AIDS Awareness Day. So welcome, Diana. And then we also have us joining us is Pamela Jumper-Thurman, who is a citizen of the Cherokee Nation of Oklahoma and is an affiliate senior research scientist at Colorado State University, retired status, and president and CEO and co-owner of the Council Oak Training and Evaluation Incorporated. As part of the NNHAAD team, she has written and produced over 25 public service announcements for HIV testing in Native communities, as well as participated in the launch and marketing of the National Native American AIDS Awareness Day from its inception through 2018. And last but not least, we have Mr. Kurt Begaye, who is Dene and the capacity building specialist with the Community Health Education and Resiliency Program at the Albuquerque Area Indian Health Board. He currently serves as the co-coordinator for the National Native HIV Network and has been involved with NNHAAD since its inception in 2016 and has assisted with the social marketing for NNHAAD for the past decade. So we have three great panelists joining us here today with a lot of knowledge and a lot of community participation in helping us to organize and continue the National Native HIV/AIDS Awareness Day, which we use the acronyms as NNHAAD as well. So we want to welcome our panelists to this presentation. Thank you.
The webinar today is brought to you by the National Native HIV Network. The National Native HIV Network is an Indigenous-led initiative that mobilizes American Indian, Alaska Native, and also Native Hawaiian communities affected by HIV through peer-to-peer and programmatic support, training, and capacity building assistance. Our comprehensive approach is rooted in our cultural values, teachings, and affection for our communities. The network began in 2016 by a group grassroots efforts of Native individuals working within the public health and the HIV/AIDS fields. Beginning in 2019, we received support through the Indian Health Service from the Minority HIV/AIDS Fund, and that allowed us to expand our network to include representatives from these areas seen here in the map. We have regional representatives from each of these areas, and you can see our regional representatives on our website at www.nnhn.org. We have been hosting bi-monthly meetings, conducting webinars, and also promoting the coordination of NNHAAD and also other HIV awareness days. And we also have created a social media presence on our Facebook page and also Instagram at Native HIV. Please follow us, and we thank you for joining us today.
All right, thank you, Savannah, for that update on the National Native HIV Network and providing us a visual of the map of how we coordinate the network with representatives. So now we are back to our panelists today for our discussion. And we're really excited to have three individuals who have been in the HIV prevention field for many years and have provided a lot of great resources and continue to do so for our Native communities. So we wanted to honor them today by having them be a part of this discussion and talking about the history, the inception, of the National Native HIV/AIDS Awareness Day. So I have a couple of questions here for our panelists to answer during this discussion. And the first one is to Pamela Jumper-Thurman. The first question I have for you is, please provide an overview of how the National Native HIV/AIDS Awareness Day was developed and what prompted the development and who was involved in that development as well.
Hello, everyone. Well, we had a great many people involved in it. We were actually one of the last few groups of the ethnic groups to be able to have a National Native HIV/AIDS Awareness Day. And CDC funded it through our CEBA agency, CEBA meaning Capacity Building Assistance. And at the beginning, there were 3 of us, Intertribal Council of Arizona. And that team was Diana Mitchell, Michelle Sabori, and Gilbert Sabori. And there may have been someone else, I may have forgotten a name. And then we had NAPSI, who had a whole team, Carolyn Kowalai, Kurt Begaye, Laura. We had just so many. Elton, I think you were involved in that too. And so many others from their team. And then from our KSA team, the Commitment to Action for 7th Generation Awareness and Education, we had Martha Burnside, we had Barbara Plested, Irene Vernon, the fabulous Irene Vernon, and we also had Andrea Israel. And we really did enjoy working as a team. We had regular team meetings once we were granted the permission from CDC or the sanction from CDC. And that team was Olivia Marr and Benny Farrow. And they really worked hard to advocate for us and help in any way they could. They were later joined by Patricia Patrick, who also was a big supporter of National Native HIV/AIDS Awareness Day. And we began by creating a survey as a team, and we sent that survey out to all of our listservs because in those days we didn't really have Facebook. So we actually used email listservs, and we sent out the survey to ask what day would be the best day to hold Native HIV/AIDS Awareness Day and why. And we had many replies that thought November, when it was Native Month, Native Heritage Month. But the majority of people came in with the spring equinox, and they felt that that was appropriate because that was a time of renewal, a time of rebirth, and a time that many tribes held ceremonies. And so we decided that based on the survey, it should be held on the spring equinox. So every year that may change a little. Last year it was actually on the 19th of March. This year it's on the 20th of March. And so that's how it originated and came about. And we worked as a team to come up with the theme for that year, to come up with a poster, and to begin from there. And that launched the first day in 2007.
Okay, thank you, Pam, for that. You mentioned a lot of names, and you reminded me of those many years back of participating as well. But I remember filling out the survey and how that went out to the community to be able to develop, the awareness day. So thank you for recognizing the individuals that were involved in the process. Definitely. So the next question is for Kurt. Kurt. This was kind of mentioned by Pamela, but maybe you can further add to it. But how was the date for the National Native HIV/AIDS Awareness Day selected? What months and dates were considered, in coming up with that specific date?
Hi, good afternoon and good morning to everyone, and welcome to our webinar. And thank you all for joining us. And just like Pamela had mentioned, we as we were gaining momentum in terms of the planning and really trying to identify when NNHAAD would take place, we were looking at to see what was already happening with the other racial ethnic groups, African American group, the Latino group, the API group. And so we were seeing that the theme with those other groups was that their Awareness Day was taking place in conjunction with their Heritage Month. So the Black History Month is in February, and so the Black HIV/AIDS Awareness Day takes place in February. The API HIV Awareness Day takes place in May, which is also the API Heritage Month, and the Latinx Heritage Month crosses from mid-September to mid-October, and the Latinx HIV/AIDS Awareness Day takes place in early October. So we were really having that discussion, and so we were talking about how November is Native American History Month, and so we were just thinking, if we went along with the general theme of what was happening nationwide, we should probably identify November. But then we were saying, well, no, let's take a step back. Let's look at this from a Native perspective and really try to and really involve the community, but also really look at what are significant time periods within Native communities across the country. And so that really spurred that momentum of developing that survey, and then really, and sent, like Pam said, sending out via email listservs. Not quite snail mail, we weren't that old yet at that time. So it was really done through our listservs, and really just word of mouth really too as well. Whenever we were in the community, we were just trying to solicit that type of feedback. And the unanimous response that we were getting was spring equinox. And so we definitely had that conversation and really chose to go along with that time period, because again, like Pam had mentioned, it was a time of rejuvenation, of renewal, and we really wanted to approach this not that HIV is it's like a death sentence, or it's really there's some finality to it, or that was very dark. We wanted it to be something bright and something that we could really come from a positive focus, from a strengths-based focus. And so we really thought about that springtime renewal and regeneration. And really just part of that, we also, in 2006, for those of you who were in the field at that time, may remember that the Embracing Our Traditions Native Conference took place in Anchorage, Alaska. And at the day after the conference was over, we had a post-conference session where we talked about the Awareness Day as well, and really tried to gather as well as much information as possible at that time. And so I remember sharing the stage with Diana and Pam, and really fielding those questions and really trying to gather like when would be an appropriate time, and really what was the community wanting to have put into this Awareness Day. So that's kind of really in a nutshell how the Awareness Day was identified.
Great, thank you, Kurt, for that response. And, I think part of the challenge too for our communities, the Native communities, is kind of coordinating and solidifying a common day, right? Because we're so different. We have 572 different federally recognized tribes. We have our Alaska Native relatives, as well as our Native Hawaiian relatives. So I can see the amount of time it took and amount of strategy it took to be able to come up with, that date. So thank you for sharing that, and then also just the cultural elements that are involved with spring and seasons. So I think that is also important. So thank you for sharing that. The next question is for Diana Mitchell. And I apologize if I may have said your name incorrectly. I was a little nervous and excited to see everyone. But Diana Mitchell, this question for you is, what significance did NNHAAD have for Native communities when it was first launched?
Okay, welcome, and thank you for the invitation to participate in this call today. For us, I know the significance in that was making sure there was inclusion for tribal communities within the National Native HIV/AIDS Awareness Day, to make sure that we had the inclusion of the urban, the tribal, and making sure that we included everybody, because we all came from different realms, but yet there was not that many programs that were working for American Indians at that time. So it was interesting to get all the information and how was it we could do it culturally appropriately, with all the work that we did with the training and technical assistance, and making sure that from the areas that we were getting the information from, that we were able to share it appropriately. And that it was something that included not only just those within the city, but out in the urban and out in the rural areas for tribes. Thank you.
Yes, thank you for that. And thank you for letting people know too of the different environments that our people live in. You know, a lot of people most times think that Native people continue to live on a reservation. What is a reservation? But our population is actually really diverse geographically, because there are some of us who still live on the reservation. There are others who live away from the reservation in urban areas, you know, and so we need to be able to recognize our relatives in those spaces as well. So thank you for sharing that. Our next question goes to Pam. And I have one of these, and I was actually trying to look for it. I was going to put it up. But in the past, there was a National Native HIV/AIDS Awareness Day Pendleton blanket that was commissioned by the Pendleton Company in Oregon. I know it was developed. I have one. I was honored with one of those blankets. But could you tell us how that specific design concept first came about?
Sure, I would be happy to. We were at a conference, and it was actually in Oregon. And so we went over to the Pendleton store, and that was, I think, myself and Martha and maybe a couple of other people. I can't remember who now. I believe Michelle was with us too. And we were in the Pendleton store talking, and this man came in and he was talking about blankets, and Martha overheard him say he was one of the designers. So of course, Martha being Martha ran over and said, well, tell us, you know, we have ideas too. And we just started a conversation with him. His name was Bob Christnocht, and we've actually stayed in touch with him because of his commitment to what we did. And so we worked with him and designed a Pendleton blanket, and we tried to incorporate everything. The whole team worked on it, on bringing in some of the symbols of the Pacific Rim, bringing in the symbols of the woodland designs, the Southwest designs. We tried to look at the language groups and bring in a little bit of all of it. And instead of putting the AIDS ribbon, I think our theme that year was to start the conversation. And so we unfurled the ribbon so that it flowed through the blanket to symbolize starting the conversation about HIV and opening it up. And so that's how the design came to be. It was really a group effort. And so in order to, CDC wouldn't fund that, obviously, because it was a product. And so what we did was sell 100 kind of special blankets, commemorative blankets, and we sold them at a much higher cost, and that paid for the production of the other blankets that were then sold at a reasonable cost. I believe they were $175, and we had a limited run of those, and then they sold out almost immediately. And then I believe it was Love Foster from SAMHSA came in, and she loved the blankets, and she said, I will give you another 20,000 to make more blankets. So we were able to produce more blankets, and then all of those were sold, and all of that money went back to each organization to do other NAD activities. For CASE, ours were marked specifically for buying other NAD products and supplying the community with NAD markings and brands and things like that, T-shirts, a little bit of everything.
Wow. Thank you for sharing. I have, you know, as I mentioned, I was honored with receiving one of those blanks, but the history and knowing, I just learned something right now, you know, in terms of the ribbon. Like I often wondered why the ribbon was unrolled, and now I know the history of that. So thank you. It is a beautiful blanket. And, you know, as Native people, we're very creative as well. But, you know, I think even the process that you all went through in designing the Pendleton blanket was extraordinary. I mean, you had to get designs from the different communities we represent, but also put it on a, you know, a brand that most Native people know about, which is Pendleton. And I often say things happen for a reason. So sharing that story about Martha going over there and eavesdropping, no, I'm just kidding, you know, is great. So it's very beautiful. So thank you for sharing that.
Excuse me, can I add one more thing?
Please.
I did remember that Bob told us that he always takes the blankets into the design team and shows them to the design team, and then they kind of rate them as to how many blankets should be produced and things like that. And even though ours wasn't a Pendleton product of their creation or design, he went ahead and took the blanket in, and he said when he unfurled the blanket that there was a gasp in the room, that everybody loved the blanket. Their entire design team said it was one of the most extraordinary blankets they had seen. So we took that to be a big compliment.
Yes, definitely. I can definitely agree. And, you know, even with the colors that were on there, it's just beautiful. So, and I'm one of those natives that it's still in a box. I only bring it out on special occasions. So, you know, I do have one. So thank you. And giving us that history about the blanket, you know, very much appreciative. So also, you know, keeping with that, you know, keeping with that concept of artistry of our Native communities, we also, as a part of NNHAAD, there was a logo that was designed, and I'm going to offer this question up to Diana. But please share with us the development process for the inlay ribbon design that has now become the NNHAAD logo. And for some of you who may not know about the NNHAAD design, but inlay is a concept that Native people use in our jewelry. And so a ribbon was designed in that concept with different stones in it. So Diana, if you could tell us a little bit about that history.
Okay. Once with the Intertribal Council of Arizona, we had some of the deliverables, and one of those that we all participated in was each year we changed who created and did the posters for the NNHAAD. And for us, we actually sent an email out and contracted some of the artists and gave them ideas on what it is that we were looking for. And we did have the gentleman's name was Ryan Singer, who actually did a painting for us. And I think his is now Burning Wagon. I can't remember what he has another name for the rest of the artwork that he does. And it was part of the drum, and then the painting of the ribbon on top of it. And that was our portion contribution when we were creating some of the posters that were annually sent out, and which included, you know, local people, urban people, and each one of those posters. And we utilized a lot of the artists within the area in Phoenix to do the different deliverables that we had, including like the banners for Intertribal Council for the National Native HIV/AIDS Prevention Program. We had some very large banners that drew people, you know, to our booths when we had to do the booths at United States Conference on AIDS and some of the other local ones, the Circle of Harmony, some of those other events. And so that's basically how we came up with the ribbon portion. And then I can see that it's continued on, because I know we did the pins, and now you see them on t-shirts and some other little things that we have that's been produced throughout the years. So that's how that came about, was utilizing our local artists in that area. Thanks.
Thank you for that. And I like the you know, ability for us to reach out and, you know, use our own resources in terms of our Native artists, you know, to produce some of these logos as well as designs as well. So I appreciate that, you know, and also vice versa. It's an education opportunity as well, you know, when we're doing HIV prevention and working with artists. So thank you for that. The next question is an open-ended question, and for all of our panelists, we want to know, when the National Native HIV/AIDS Awareness Day was first launched, what were your hopes for the Awareness Day? And we can start with Kurt.
Yeah, we're supposed to go with our elders first. No, I'm teasing. I know that for me, when we were first creating the Awareness Day, coming up with that concept, and I was very happy to see that we were finally getting some recognition, because often, you know, the Native communities are often left behind when it comes to national movements and some of these activities. And so I was very happy to see that we had our day. We were getting that recognition, not only for the natives in the lower 48, but also inclusive of Alaska and Hawaii, and really just wanting to make sure that we had that recognition. And for me, my hope was that we would be able to sustain the day, that that we knew that there was CDC backing, but we also wanted to make this very community oriented. And so that was my hope, that it would really catch fire and that people would become excited about the day, and that communities across the country would be excited when spring was coming around, that, hey, NNHAAD is coming around, let's start planning, let's start organizing, let's start mobilizing, let's really plan activities around this day, but not only just around this day, but throughout the year, but let's have a national presence on this day, because it is our day. It is a time for us to really showcase what's happening within Native communities, what's the gains and strides that we have achieved for ourselves with very limited funding, very limited resources, and oftentimes being forgotten. So, I really like that it was a team effort from the 3 SIBA providers coming together and really just planning, strategizing, and just brainstorming, how do we do this? How do we make this happen? How do we make this successful? And so my hope was really that it would just become a time for us to really celebrate Native communities and just really sustain this through the years, because we know funding's always going to dwindle at some time. So we really want it to be very sustainable by the community.
Good, thank you. Pamela, the same question. What were your hopes for the Awareness Day?
Well, I would echo what Kurt said. I certainly wanted to see it perpetuate and to grow. And we had a lot of support from different sources like Love Foster and Benny Farrow and Olivia to try and keep that going. But when all of our SIBA services were terminated in 2014 and no Native SIBA was funded at all, we had to depend on the community. And we really had a lot of community support. And so for 2 years, the community itself, we just used Facebook, we used whatever social media that we could and kept it going. And Andrea went ahead and did posters that year. And then ETR stepped up and they came along in 2015, late 2015. So they helped us to keep the process going in 2016. And we had suggested that they bring Kurt on board, and they brought Kurt on board. And so with Kurt's youth and enthusiasm, that's just really gone a long way to keep this day going. And I'm so grateful to him for making sure that he keeps doing that. And so it has gone on, but we really wanted it to also bring attention to the data challenges that we face every day. We're, quote, something else, aren't we? We are the others. We are so much, and not to get too political, but Natives often get overlooked and we're invisible. And so Native Awareness Day brings attention to all of those things and gives us the opportunity to educate people nationally about the needs that we have.
So thank you, Pam, for your input. And it's okay to get political. No, I'm just joking. But yeah, I think your synopsis of the day is, it's a day to highlight some of the challenges as Native people that we have to endure, and and then also look for solutions, right, as well. How can we collaborate and work together for, to enable us to do better. Diana, I'm going to pose the same question to you. When NNHAAD was first launched, what were your hopes for the Awareness Day?
I know for our agency, when we were out working on the out in the tribes and stuff, so that they would be comfortable with knowing that we are a population that is affected by HIV and AIDS, and then also for my personal level to see at some of the larger conference where we actually did promote, that, hey, we're part of this community too. Because I remember that on some of their documents that they did provide at that time, that we did have to talk about where they had all the other ethnicities, but we weren't mentioned. and that we pushed the issue to make sure that American Indians and tribal nations, Alaska Natives, were included in some of those documents. I remember, I think it's United States Conference on AIDS was one of them, where they went and advocated together as a team, and went and made sure that we let them know that we were in that population. And I remember all of us going up with our shawls at one time up on the stage in one of the conferences. I can't remember his name, had to go up there and say, that there are other ethnicities, and American Indians is one of them. And making sure that, with our tribal programs, that, for them to get comfortable with the material, and that, because some of our tribes there in Arizona, they were able to, with the NARCIT program, with the instructor training, that they actually, converted it to their own languages and adapted it in that way and did the trainings. I think White Mountain was one that they did their training and they incorporated the language into it. They did it in Apache. So it was really nice to see that those CHRs were utilizing that material. And that's what we wanted them to do, to be self-sufficient, so they could teach us with comfort and cultural appropriateness within their own community, because I know some of the things that we were sharing within the training, culturally, some were, how do you say a disease when there's no word for it? So that was important for us too. So, that was it, just making sure that we were included and comfortable with the information. Thanks.
And just real quick, Elton, I wanted to kind of, as I was listening to Diana's talk, it spurred something in me that I remembered about the Awareness Day, is that we also wanted this to be a conversation starter, that we wanted to be able to destigmatize the conversation around HIV, especially within our communities. And so having, Elton, I remember you were part of the poster campaign where in those early days, we were soliciting photographs from the community to add on to the posters. And so by showcasing the faces of people in our community, not these stock photos that we see used repeatedly year after year after year, but these are fresh faces, fresh, as Elton liked to say, mutton greasy faces of our communities members on these posters. It really brings home that it is here and it is affecting our communities, and they are people, they are our relatives, they are our family members, they are our community members. So let's really begin to have these conversations and really start to break down the stigma and those barriers that are often come with having discussions around sex, around death, and just those conversations around like contraception as well. So I mean, it was really a time for us to really begin to break down those barriers and really start to address the stigma that was associated with HIV.
That's true. And if I can add something too to what Kurt said, we really did make an effort to never ever use stock photos. We always brought forth community photos. We solicited those from the community, and that's something we're all very proud of. So Kurt, I'm glad you mentioned that. And in 2015, one of the most popular themes was Hear Indigenous Voices, which was HIV. And people really got on board with that, and they sent in pictures and they sent in sayings, and they each took it and ran with it. And that was really a great year. Another thing is we've had community support from people like Wes Studi, Becky Hobbs, people, Stefan Lassard from the Dave Matthews Band, who all stepped up and said, we'll be happy to do a PSA for you. Just give us something to say and we'll add our heart to it and we'll say it. So that's how a lot of our PSAs began too, were people saying, I'm happy to do a PSA for you, just let me do it. I'm glad you said that, Kurt, because that reminded me too.
Yes, thank you. And thank you for sharing all of that. I think it's really important. I think, what your hope you wanted to do is continuing. I mean, we're seeing collaborations, we're seeing discussions about destigmatizing about HIV, and we're also giving our communities an opportunity to get tested, as well. And I think this social marketing campaign that has developed out of NNHAAD has really enhanced that cultural interpretation, whether it's with individuals that are willing to talk about HIV in a PSA, photographs of people who are doing the work and who are affected by HIV. I think some of those posters that were developed as part of the social marketing materials have now become like collector's items, but beyond that, for those that are no longer here with us, it's a reminder of who these individuals were and are, and why the work we're doing. So I think it's really led to a community response and a community recognition for all the work that you all were able to do at the beginning. So thank you for sharing all those different perspectives, you know, on the Awareness Day. And another open question for all of you is, you know, about the survival of NNHAAD and the continuance of NNHAAD. You know, we know that funding priorities have shifted. You know, in some agencies were not funded to continue the work, such as the Native SIBA network, which was involved in developing NNHAAD. But how has NNHAAD survived since 2016, you know, for over a number of years? If you could kind of let us know that, that'd be great.
Well, we've certainly survived because of youth, you know, Savannah and Kurt picking up that task and running with it, the Albuquerque Indian Health Board, kind of things lay in their lap right now to really carry it forward, and they're doing a tremendous job. I'm really grateful to ETR for the assistance they gave us after they found out that we were not funded. They really helped us starting in 2015 to keep it going at a time when we had no money, but we had social media. And thank goodness we had social media. So I think that with all of the enthusiasm from the Albuquerque Indian Health Board and Kurt Begaye and people like you, Elton, hosting this, Diana, everybody continuing to do the work. You know, I'm in my mid 70s now, but I'm still always willing to help out and do anything that I can and carry any torch that I can. I continue to write letters to CDC. So anything that we can do to continue this, it's just so vital.
Hello, this is Diana. With for my area, you know, it's always important for our youth, you know, to be educated and remembering to train them, because I know we have a large youth summit that happens out here with the tribal school here within our area, and keeping, you know, doing the trainings and actually questioning them and doing presentations within a very large conference, and finding out that they're really well versed in HIV, and then remembering how to connect it to the other issues, such as, you know, the other health disparities, such as diabetes, you know, health disease, you know, along with all that's happening with them, you know, substance abuse. So for me, that's making sure that we touch bases on there, and that they are comfortable in knowing where those resources are within our communities, you know, tribal, urban, because I know we still have that. When for testing, they usually will still go into the urban areas and get tested. So we want to make sure that we're current with sharing that information with them, you know, on updated levels, or that they're updated with that information. So it's interesting to see how it is still moving forward, and then is how we connect all those dots for them, so that way they're interested and think, oh wow, what's new? Because it's changed so much in the past few years. Thanks.
And then just kind of, I know that on the last question, Pam had touched on this in terms of after the defunding of the National Native SIBA network, there was a time there that we had no funding for NNHAAD, but it still was sustained because of efforts from the community, from individuals who volunteered to just come forward and create the posters, leverage social media, and just provide that really coordination from our homes, and just really just when we had the spare time, let's really try to get something out there and really maintain NNHAAD for the community, because we knew if we let it drop, then there may not be someone else to pick it up for us. So we wanted to make sure that for the community, and again, I think the resounding theme here is that it was about the community. It was by the community for the community. And so when ETR stepped in, we were very, very thankful for that. And so being able to then have a structure to coordinate efforts again, and then eventually that funding went away again. And then now we have a new round of funding and a new coordinated effort. And so I think it's just, it speaks to the tenacity of us as Native people, and just speaks to the heart that we all have for this work. So, so I just wanted to kind of reiterate that point, that it was really sustained by the community, despite having funding and those resources available. That it was just, we made it happen.
Well, this is Diana again. And then also the importance of, the housing, like the data, and that, because I know without the support of the data and the surveillance and all that information, that, that changes the funding, process, and that, the need to have those things in place, is important, because otherwise it goes to the wayside. I know for myself that with the programs that I worked under, sometimes if you don't have the data that supports the need for that program, those programs go away. So that's why I feel that it's important for us to keep pushing that we do need those surveillance and data housed, so that it's important that we continue the work that we do. Thanks.
Yes, and thank you for sharing those perspectives on the sustainability, of a movement. And I call NNHAAD a movement, because when I first came into the HIV prevention field, I had mentors, and I consider both of you mentors, Pamela and Diana, and the work that you did when I first got engaged in the work in public health. And I learned a lot from the agencies that were a part of the SIBA network. And I really appreciate that. But I think, the compassion, the investment from people who work in this field is so extraordinary in our Native community, that we have mobilized our community to keep this day going, which I think is significantly important. And we've also collaborated as well with different agencies, whether they're federal agencies, other Native nonprofit agencies, but that collaboration as well is key, because some of these agencies didn't know we, I shouldn't say we existed, but that we were a key population in this work that we were doing, right? So I think this movement and this mobilization has been really important, even if we didn't have money, right? I was being the model for a lot of the posters, and then it stopped. No, I'm joking. So thank you for sharing that. I think it's important, to share that perspective on how we work on a grassroots level to continue such movements like NNHAAD. So thank you for sharing that. I'm going to go ahead and wrap up the discussion with the final question to Kurt. To tell us a little bit more about the National Native HIV Network and the role that it is playing with the National Native HIV AIDS Awareness Day today. So, Kurt?
Okay, thank you. So for those on the call who may not be aware, the National Native HIV Network began with 5 individuals from the community who really saw that need for a concerted mobilized effort, and really just speaking to the need that we needed some structure in terms of how we approach HIV. And we really, with the defunding of the Native SIBA network, that left a huge gap in terms of coordination on a national level as far as HIV prevention, care, and treatment. And so 5 individuals came together from the community and really started planning and soliciting input from participants at various summits and national conferences, regional conferences, really just trying to figure out how do we create this type of structure. And so that mobilization really happened from a grassroots effort and continued starting 2016. And then in 2019, the network was fortunate enough to get some financial support from the Minority HIV/AIDS Fund, which really helped to provide, again, added structure, added cohesion to, and really helped to broaden our effort and our mission. And so in 2020, those of us on the network approached Pamela and we said, we know that there's a need for a lead entity to start to coordinate NNHAAD. Can we have your blessing to take that over? And so Pamela graciously said, yes, do it. And very enthusiastically said, do it. We need someone to take over coordination. So last year, the network began coordination of NNHAAD, and really we came out at it a little late in the game. And so we just rushed to get the poster started, to leverage social media because we wanted to leverage what resources we had at that time. But then for this year, we really were intentional about how to approach NNHAAD and how to approach the marketing, what products to develop. And so looking at what was happening on the national landscape as far as the new National HIV/AIDS strategy, the Ending the HIV Epidemic, or Ending the HIV Epidemic Initiative, we began to structure our theme around those two national initiatives. And so this year's theme is Zero is Possible Together, Innovation Plus Awareness. And so we were very cognizant of, okay, what things do we need to get in place? So one thing was the NNHAAD website that was created during the time when KSA was funded as part of the Native SIBA network. And so we said, okay, let's look at the website, let's update it, let's add to it, but also let's be mindful of the history of NNHAAD and the history that was already captured on that website. And so we really brought forth all of that information and content to the current website. We replicated some of the things that were already there in terms of the events map, that there's a form there for communities to come in and really be able to input and information about events that may be taking place in their local area. And then that information gets populated to a national map so that folks can, as they're visiting the website, can click on those states and see what's happening in their local area. We also wanted to, again, keep that history alive. So we have an archive of all the materials from the previous years on the website. We also have products that were developed specifically for this year's Awareness Day also on that website, where folks can come in and order from us, and we will send that information out and send those resources out. And so again, through the support of the Minority HIV/AIDS Fund, we're able to get this done. We're able to get all of these products developed and then shipped out at no cost to the community. So it's about the community, really making sure that we're providing that structure and that resource. And again, going back to sustainability. So if you haven't visited our website, the web address is there on the screen, www.nnhaad.org. Savannah, if you could forward the slide, please. Oops, too much. So here are the products for this year. So every year, like Pam and we've all kind of shared, that we had a poster that really hit home on the year's events, that theme for that particular year. And so leveraging the regional representatives that are part of the National Native HIV Network, we were really, we wanted to make sure, again, that the poster that we were developing represented the communities across the country. So you see here our theme. We also have the logo, the NNHAAD logo, the inlaid ribbon there at the top right-hand corner of the poster. But also you see in the central image, an image of community. Again, going back, I keep harping on community because it's all about the community. We wouldn't be here without them. So this is a group photo taken at the 2019 Circle of Harmony HIV/AIDS Wellness Conference here in Albuquerque. And again, just showcasing our people, and that it takes a group effort to really be able to come together and achieve zero new cases of HIV. So it's really about us coming together and really sharing those innovations and awareness. But also you see the green braid, the green sweetgrass braid, and we were very aware in terms of why we wanted to use that particular image. And So for some of us, we burn sweetgrass as it's part of our prayer, it's a part of our smudging, it's just a part of our daily ritual. And so it's about, again, that connection to the earth, to our spirituality, to our culture. For others, the braid represents weaving. And so how is it that coming together, it's part of our culture, part of our artistry. And for others, it was indicative of the community and the strength within that community, that the more strands within that braid, the tighter and stronger the community is. And so we wanted really to have that represented. And so that braid, although very simple, carries a lot of significance within all of our cultures across the country. So we were very intentional about that development and how that was represented on our poster for this year. And so again, looking at it from a marketing perspective, we really wanted to make sure that we were branding this year's Awareness Day theme and look and concept. So we have various, you see that with the poster to the sticker that is in the upper right-hand corner, to even the t-shirts that were developed here. I'm wearing that here, I'm not sure if you can see that, but we were very aware and intentional about making sure that we had a consistent branding. And so if you go to the website, the NNHAAD website, on the products page, if you keep scrolling down below the order form, you will see all the downloadable NNHAAD graphics for this year. So we have the Facebook banner images, we have Instagram graphics there. So you're able to download these and utilize them for your own organization, social marketing efforts, or for your own personal postings for NNHAAD on Saturday. So we really wanted to provide all of these products so that individuals from the community could, again, have access for them and amplify the messaging about NNHAAD across the country. But also, again, just having that connection to one another, and then just really just building that momentum and excitement about the Awareness Day, that we are still here and the Awareness Day is still happening. So that's all I got, Alton.
And thank you, Kurt, for that explanation of the network as well as the products that have been developed. And thank you for mentioning the continued support of the Minority HIV/AIDS Fund and the collaboration with Indian Health Services, who really wanted to push this day towards the community to kind of help to assist and develop. So thank you for explaining that. We have outreach to another Native graphic artist who's been amazing to work with and has worked with us the last 2 years in producing some of these imageries as well. And her name is Jolene Yazzie. I almost called her by her nickname, but by Jolene Yazzie, who has been wonderful to work with, has worked with the network on producing these images. And prior to having this graphic artist, we also had Andrea Israel, who worked at KSA as well, who did some amazing posters. As I mentioned before, they're collector's items. If you look at some of these designs that we were able to do, and very creative, and bringing all our cultural perspectives together, I think is one of the most challenging things to do. So, Kurt's explanation of the sweetgrass or the braid can be taken into different Native communities and understood in that way. So I appreciated that. And then earlier we were talking about the inlay image of the ribbon. That is the inlay image that we have on the screen here with the turquoise and pink and red coral shells, or well, not shells, stones that are used. So that was the image we were making reference to earlier. So thank you for sharing that. And all these products are downloadable on nnhaad.org. So you can produce those, and print them. And then also, if you want to make some orders, I don't know if that's still available, but we may have some vintage t-shirts available after, the day happens. But thank you for giving us this opportunity to talk about the history of the National Native HIV/AIDS Awareness Day. Before we close, I want to give our panelists any last final words or comments you would like to share with us today.
I just want to say thank you to everyone from all the way back to 2007 for all the efforts. And I know there are names that I've forgotten to mention and people that I've forgotten to acknowledge and communities who have gone above and beyond that I've forgotten to mention. But I really want to offer a thank you to everyone that has participated in all of them, and then offer a future thank you to all of those who will be participating in the future and building on NAD and making it become even better and perpetuating it, just simply perpetuating it. And that's Savannah, Kurt, Elton, all of you younger people that are now carrying the torch.
Hi, this is Diana. For me, I want to say thank you, Kurt, for inviting me. It brings back a lot of really good memories in the work and the travel and the same group of 15 of us that was always constantly gathering. Even just having our side meetings, at the booths that we all shared at different events and talking about things that happened and all that entailed with the work that we did, and that it was important that our voices were heard. And thank you again, because it was nice today. Thank you.
And just I know that NAPC being the larger agency out of the three SIBO networks, I like to just honor those individuals who were part of NAPC at the time when NNHAAD was created. So there was Michael Bird, Laura Oropeza, Charlene Worley, Deborah Scott, Carolyn Kuali'i, Allison Whitmore, Christopher Paisano, Dennis Manuelito, China Ching, Cece Sapp, Maria Topete, Myra Lozada, Ken Harper. And there were individuals at NAPC before that time, including Larry Kay, Vince Sanabria, Matt Ignacio, Ron Rowell. So these are all individuals who created a legacy for all of us. For those of us, as Pam likes to call us young folk who are carrying that torch. And I think that it's time for us to also start to look to the future generation to see how do we start to cultivate that next generation of leadership so that we can pass that torch on and keep that legacy alive. So I'm very thankful to have been part of this creation of the Awareness Day, and also happy that I'm still continuing to keep it alive. And so I'm hoping that we can trust it into some very great hands for the future generations. So again, thank you to everyone for being a part of the conversation today.
Thank you, Kurt, and to our panelists. We have a question in the chat here that I will go ahead and read from Calvin Hilton. This might have already been discussed. How and why was March 20th chosen? And it was discussed early in the presentation, but we can rebrief it. Kurt? So just how and why was March 20th chosen?
Yeah, so again, we did cover that early on. At the time when we were coming together to plan the date, we were just wanting to see which dates were very significant for Native community. There was, again, November was Native American History Month, so we thought of dates during that time period. But then we, as the SIBO network, also knew that it shouldn't be us dictating the date, that it really needed to come from folks in the community. And so a survey was developed, disseminated via email and word of mouth. And really, we were able to then gather feedback from the community, and a resounding response was spring equinox, just because of what it symbolizes for many cultures and tribes across the country. And so that was the date that was chosen, the spring equinox. And so depending on the year, it could be March 19th through the 21st. And so this year, March 20th is the day that the spring equinox falls upon. So that's how that date was chosen.
Thank you, Kurt, for kind of wrapping that up. We appreciate that. And I also wanted to mention a comment from Auntie Carolyn Kuali'i. Auntie Carolyn states, the National AIDS Memorial honors Native Americans lost to AIDS with this special virtual exhibition of the AIDS Memorial Quilt, which features 16 quilt blocks that contain panels made to honor loved ones from the American Indian, Alaska Native, and Native Hawaiian communities, to be launched later today. This web banner has the blanket design on it. So the design we talked about earlier has the design. And the website that where you can visit this virtual memorial is www.aidsmemorial.org/native quilt. And if you need that website again, it is in the chat from Carolyn Ku'ali'i. It'll be launched later today. I just checked that website and it's still under construction, but hopefully people will be able to visit that. But that too is also a great honor to have that display of our relatives who have passed on from the virus. So thank you for sharing that, Auntie Carolyn. You know, another great artist in our community, Auntie Carolyn Ku'ali'i, who's worked in this movement as well. So thank you for sharing that. Are there any questions, any more questions people would like to ask?
There was a question in the Q&A that I did see about products, and you can still order products. I will be typing in the URL into the chat box. So you can still order them. We still have products available. So you can order them, and just know that they will arrive after the awareness day has passed, but we do have resources and products that you can request and we can ship out. And I did just put the website address in the chat box.
And thank you, Kurt. And, you know, and thank you to the Albuquerque Area Indian and Health Board team for putting together and packaging all those materials. I know it is a big task. I really want to thank everyone on the panel for being here, for reminiscing, bringing back good memories, and, you know, just having this conversation really again instills, and, you know, at least for me, instills that support as well as that enthusiasm to continue the work that we do in honoring our relatives and educating them about HIV and AIDS. So thank you from the bottom of my heart for being here and just sharing your involvement. And then also just for the participants for taking time to hearing the history, the legacy, I like that word that was mentioned, the legacy of our community in honoring this day as it is. So, you know, hopefully everyone will continue to spread this message, get people tested for HIV. Saturday is a good day to remember that. I know there are a number of agencies throughout the US, some of our federal partners are as well, and non-native agencies who are doing panels, webinars, events throughout the country, which may be a little bit limited this year because we are still going through a pandemic, but hopefully we'll be able to get you know, the word out for everyone and order the products. They're wonderful products this year. I really like the fabric of the t-shirt. We have Indian sizes, so don't let that scare you as well. So we'll be able to get them. And the stickers, I think stickers are going to be great, and bookmarks. So, you know, feel free to order the products.
Elton, one more thing before we leave, a plug for social media. Again, as you're posting on social media, we do have 3 different official hashtags for NNHAAD this year. Hashtag, just again, hashtag NNHAAD, hashtag 0 is possible together, and hashtag Native HIV. And I will, Savannah, if you can put those into the chat box, thank you. So as you're posting either on Facebook, on Instagram, on Twitter, to please utilize those hashtags with your posts, and that way it allows us to track the conversations and engagement that are happening. And again, it showcases just that the communication is alive and well and that it's happening. So it's not #, it's hashtag for those of you. So thank you.
And that's an inside joke, and that is me. I'm so technologically challenged sometimes. So I called it #, not hashtag. So, you know, and that's another portion of, you know, of what we're doing is really developing our social media outreach. We are in a social media age, as mentioned before. So, you know, we're hoping to get that going as well.
Also,
so go ahead.
We also have a drag show or drag bingo this evening featuring Eartha Quake and also Prepahantis with a special performance by Tony Enos. So please register for that. You do have to register in order to receive a bingo card. We will have prizes for that. So please, I think we can share the link here in the chat here in a bit. But I think the other portion is register for or sign up for our newsletter. We do share stories from all of our regional representatives who have been involved in the development of all of our products that we have sent out for NNHAAD. And, you know, we're so grateful for their involvement. And, you know, we've been very intentional about including our Native Hawaiian relatives because they are often excluded from, you know, the portions of HIV as well. And so please subscribe for our newsletter and follow us on our social media. Thank you.
I'm on mute. Thank you, Savannah. I also put the registration info in the chat for our virtual drag bingo this evening. So if you want to meet my other personality, Eartha Quake, please join us. And then also Prepahantis from New York City and our special guest, Tony Enos, who has a beautiful song that he'll be able to release for us. So thank you again. And we appreciate our panelists, our relatives, our colleagues, and those of you who joined us today for honoring the National Native HIV/AIDS Awareness Day for this year. So again, thank you and continued blessings and stay safe.